How can I, as a man, avoid erectile dysfunction, impotence, poor erections? When men are unable to maintain an erection while having sex, it haunts men more than anything else in the world. Yes, they can testify to this. So men, what can you do about loss of erection? And how can you maintain longer erections, you may ask?
Wow.
I'll tell you. Hi, I'm Dr. Hadiza Marilia Suleiman, your favorite holistic reconstructive surgeon. And yes, erectile dysfunction becomes more common as men age. But it doesn't have to always be a normal part of aging, does it? So, you may be asking, how do I protect my potency as a man? Well, luckily, most of these factors are completely within your control, letting you take steps to protect your erection and avoid erectile dysfunction without necessarily having to use medication. I want you to listen to these completely natural ways to maintain erections, and I have a surprise for you about poor erections, so stick to the end of this video. Believe it or not, some cases of erectile dysfunction stem from injuries to the penis that occur during risky or violent sex. Yes, this kind of violent sex can rupture the corpora cavernosa, and these are elongated erectile chambers that run throughout the length of your penis. So hey, take it easy when thrusting that penis, or else you may end up in the surgery. I've had some people ask me, doctor, can I blame my medicines? Well, maybe. Some blood pressure drugs like beta blockers and certain antidepressants can make it tough for some men to get a strong erection. Beta blockers are commonly used in patients who have hypertension and other heart conditions. So guys, hey, please don't just stop taking those medicines. Talk to your doctor. You may need to switch to something else, okay? Do you really need to even drink alcohol? Chronically drinking alcohol may actually interfere with the normal balance of male sexual hormones, preventing that turgid penis. Are you an athlete? Please don't abuse those anabolic steroids. They can shrink your testicles, and this can be a disaster for your sex life. And they can sap the ability of those testicles to make testosterone. And my lovely men, don't ignore those free cholesterol and blood pressure checks. A lot of hospitals offer free or subsidized screenings, so why not just go for them? Watch out for that constant bicycle riding. Yes, we know that exercise is very important, but do you know that excessive pressure in that area in particular can cause erectile dysfunction? You may ask, well, what about men who spend a lot of time biking? Well, they should make sure that their bike fits them properly. Let them wear padded cycling pants and stand up frequently while pedaling those bicycles. Any form of exercise that puts excessive pressure on the area between the scrotum and the anus, which is called the perineum, by damaging the blood vessels and the nerves that supply the penis is not too good, is it? This is because bike riding can compress the pudendal artery, which is vital to that area. So while an occasional short ride is unlikely to cause trouble, the United States National Institute for Occupational Safety and Health has recommended no-nose bike seats to protect against genital numbness and sexual dysfunction, which provides blood flow to the penis. So use that special bike seat, which is sometimes called a split seat, along with wearing special shorts. These can help prevent your impotence, your erectile dysfunction, your poor erections. Can I really rely on Kegel's exercises, doctor? This is a form of exercise that involves repeatedly contracting and relaxing the muscles in the pelvis. Remember those exercises they usually tell females to do to help strengthen their pelvic muscles? Well, it doesn't only apply to females. This Kegel's exercise has been said to strengthen your pelvic floor muscles, which in turn helps to sustain an erection by helping to produce an increase in the penis pressure and, of course, the rigidity of the penis. Not getting enough sleep. I'm not getting enough sleep, doctor, especially as a result of sleep disorders like sleep apnea. Well, sleep apnea has been linked to an increased risk of erectile dysfunction. Losing sleep can also make you more likely to develop plaque in your arteries, also known as atherosclerosis. And this can affect your circulation and in turn make it more difficult to get and maintain that erection. Before we get into the next one, 68% of people who are watching this channel are not subscribed. And I want to make sure I bring down that number to 50%. So why not hit that subscribe button if you haven't already? Because I want to make sure you're up to date with all the current healthy information so that you become the healthiest ever version of yourself. Yes, absolutely. Your lifestyle could play a role in your not sustaining that erection. If you're overweight, getting too little exercise, and you smoke, all these can work against the good blood flow that is key to your good erections. So keep your body weight in the healthy range. And research has found out that men with a body mass index in the obese range are 3 times, guys, 3 times more likely to deal with sexual dysfunction than men with a normal body mass index. So if you're overweight with a body mass index in the range of 25 to 30, your risk is approximately 1.5 times higher than the risk for a person with a healthy weight. This increased risk of erectile dysfunction, impotence, poor erections is because obesity is closely correlated with serious health conditions like diabetes, which can damage the nerves around your penis and prevent those good erections. Erectile dysfunction from diabetes is particularly worrying because common erectile dysfunction treatments like Viagra and Cialis may not be totally effective in people with diabetes. I promised I have something important for you to know about poor erections. So click on the link below for a free resource about the complications of erectile dysfunction.